thank you all so much for joining today. It's great to see so many of you and old friends. We have a mixture of long-time Yemen observers and experts and members of parliament and others who are interested in the country, and that's terrific because this is such an important issue and it is all too often ignored or forgotten about, and this is something that we at CARBO try to address. This is, I think, our ninth webinar that we've had since the lockdown. And for those who are interested, the one that we had earlier this week with Hanan Ashrari, you can watch it or watch it again even if you would like. It's all on our website, as are details of our next webinar, which is going to be next Thursday. I shall refer to that later at the end of the meeting, but it's all there on the website for those who are interested. But without further ado, let's turn our attention to Yemen. As I said, it's one of the most important countries and conflicts in the region. We're dealing with a country that's been decimated by war, strife, and now facing yet another epidemic, COVID-19 one, in addition to the other epidemics such as cholera, which has also been a massive threat to Yemeni civilians, in particular children. Now, in terms of COVID-19, I mean, the first case officially was on the 1st of April, I believe, but I think there's serious doubts as to the credibility of official figures from all parties. And just to give you an idea that the World Health Organization says that its models suggest that under certain scenarios, up to around half of Yemen's population of 30 million could become infected, with around 40,000 dying. So that's just to give it some perspective as to what this pandemic could mean for Yemen, a country whose population, of course, as you all know, has already been devastated, much of the population in need of aid, some are suffering from acute malnutrition. And I really can't think of anybody better to talk about this right now than our guest speaker today, Nawal Al-Maghafi. We welcome, she's addressed CARBO before, and it's great to hear from her. Her journalism is top class, and that's why it's been recognized by a host of awards. And many of you may have seen her recent documentary on the Iraq's secret sex trade, which has been nominated for awards. It's a very powerful piece, highly recommended. We'll share the link. She's been reporting on the Middle East since 2012, but particularly on Yemen. First-hand reporting, which is so invaluable as she's been traveling around the country. I'm not going to go through all of her bio, which you've all had circulated to you, but I think that she brings a wealth of experience and perspective on this. And she's going to be talking today, of course, about the humanitarian situation in Yemen, the impact of COVID-19. Nawal, a very, very warm welcome to you. She's going to speak for about 15 to 20 minutes, and then we'll open it up to Q&A. As ever, if you could put any questions you have on the chat, we will take questions probably two at a time. Try to keep the questions brief and clear if you can. Nawal, over to you. Thank you so much for speaking to us today.
Thank you so much, Chris, and thank you so much for such a warm introduction. We've been talking about doing a talk at CARBO for a while, and I can't think of a more important time, but I think when we discussed it, we didn't have a Zoom call in mind. But I'm absolutely delighted that I'm doing this. I'm really glad to have so many people on the line today, people interested in hearing about Yemen and concerned about what's to come. It's a really important time for us to be discussing this. I'm going to start by introducing myself briefly. I'm the BBC special correspondent. I've been reporting on Yemen for the last 7 years, but I've really focused on Yemen since the war began. I reported on the bombing, on the cholera epidemic, diphtheria, and I also report in other regions in the Middle East. But what really strikes me about Yemen isn't only that I'm Yemeni myself, and so it's a very personal story for me, but also that every time I leave the country, I come out of it thinking, it just can't get any worse. And unfortunately, it seems that every time I think that, it does get worse. There's always something else, and it has been relentless for the last 5 years. I'm just going to give you a brief breakdown of what I'm going to be talking about today. I want to, it's difficult for me to really tell you firsthand what's happening on the ground, because for the last couple of weeks, we have been trying very hard to get into Yemen to see what's actually going on. But unfortunately, we haven't been able to. We're relying on our local team on the ground, but I myself haven't been able to go from the UK to Yemen at the moment. So I'll be reflecting on reporting on the cholera epidemic, as it will really help give you an idea of what to expect with regards to the corona response in Yemen. I'll be talking through how the humanitarian situation has worsened over the last couple of years and why Yemen is so vulnerable to the spread of COVID-19 in comparison to other countries in the region. And also discussing the latest figures and what I've been hearing firsthand from doctors and health workers on the ground, and why we're seeing such little reporting on what's going on in Yemen at the moment. I'll also be touching on how there has been politicizing of the virus and the implications that this is having to the response. If I can just remind you all again to mute your mics, make sure that your mics are muted if you haven't already, because I can hear some background noise that might interrupt people listening to the talk. So when I first heard about the coronavirus spreading here in Europe, I was really immediately terrified about the prospect of it reaching Yemen. I was in Amman at the time. It was around mid-Feb, and I was delighted to hear the news that the authorities had decided to basically lock down Yemen. So flights into the country had stopped, and this was all to try and stop the coronavirus from reaching Yemen. And I think myself and many others who closely watch Yemen were really hoping that these measures would mean the virus wouldn't reach Yemen, or at least that it would delay it enough that there was time to prepare. But, as you can see, and indeed right now, that was wishful thinking. And my fears really were rooted from my experience reporting on the cholera epidemic in late 2016, early 2017. I was in Yemen during the height of the cholera epidemic, at that time, and I traveled across the country. And before heading to Yemen, I had done some research on cholera, and I learned that it was a very easily treatable disease. And so I really wasn't prepared to see what we ended up filming. What we saw when we were covering the cholera crisis were people dying secretly at home as a result of being infected with the disease. People in villages in the mountainous areas of Yemen completely neglected, unable to access any healthcare facilities, unable to even hear some of the messaging that was being spread about how to protect yourself from the cholera epidemic. People having to walk for hours on end to reach the nearest health facility, especially because Yemen's health system has been especially destroyed after this war. It was already weak before this war, but it's had a huge impact on it even more after this war began. And also cholera, which is a contagious disease, which much less contagious than corona, spreading in IDP camps. These IDP camps were such fertile ground for the spread of this disease. And we also saw how malnutrition meant that many people were dying because they had such weak immune systems. I think there was around 2,500 recorded deaths. Nearly 60% of them were children, because they were the ones mainly infected by the malnutrition. And there were 1 million recorded infections. And I keep saying recorded because it's really important to note that the majority of these people don't actually reach health facilities, and therefore they aren't part of the statistics, they aren't accounted for. So we're sure that there were many more deaths and many more infections at the time. And it's the same elements that made Yemen more vulnerable to cholera that make it more vulnerable to corona. So at the time in 2016, 2017, approximately 16 million Yemenis were in need of humanitarian assistance to access, humanitarian assistance. And what I mean by humanitarian assistance is access to safe water, basic sanitation, and hygiene facilities. And these are the most basic needs that we keep hearing about to be able to help stop the spread of the coronavirus. You know, basic things like washing your hands is an almost impossible task in a place like Yemen. So that number of how many people need humanitarian assistance in Yemen has gone from 16 million in 2017 to 24 million now in 2020. So that's more than 2/3 of the population in desperate need of humanitarian assistance. Also, you know, this man-made disaster has been absolutely brutal on civilians. We're now seeing numbers of more than 20 million people being food insecure, and 7.4 million people don't know where their next meal is coming from. And so that doesn't only mean that 7.4 million people have weaker immune systems as a result of malnutrition, but also it means that they're more susceptible to having harsher symptoms of corona and will need hospital care in order to survive it. It's a terrifying prospect for corona, because what it means as well is that doing something like a lockdown like what we've seen here in the UK is almost impossible, because people are desperate. They need to leave their homes in order to work or in order to find food for their families. It's also meant that food distributions by NGOs have become incredibly difficult. Queues for food distributions in places like IDP camps or in tight-knit communities are places now where this virus could ultimately spread across the most vulnerable communities. And on top of all of that, I'm sure you guys have heard the latest news about the US pulling funding, and that has meant that WFP has had to cut its food distribution project in the north by half because of that, because of lack of funding. And it's meant that families who have had, families who received their last batch of food that was meant to last them for 1 month are now having to survive on it for 2 months instead. So it's, really grim numbers. An estimated 4.3 million people have fled their homes since the start of the conflict, including approximately 3.3 million people who remain displaced. And like I said before, these heavily congested, internally displaced people camps are fertile ground for disease and for the virus to spread. And the public services have broken down. When we were there in 2017, we were talking about 40% of health facilities being destroyed by the war. Today, that number stands at over 50% of health centers being dysfunctional, and medicines and equipment are very limited. And regardless of that, I think what I found really shocking as reading up on this today is in the first quarter of this month, there was a 3-fold increase on attacks on health facilities, which really goes to show you the complete disregard by the warring factions about this imminent threat. So, apart from the obvious that we already know, how will we see the response to the corona pandemic differ to the cholera epidemic? What are the differences between them? First of all, cholera was much easier to treat. It is contagious, but it's definitely not as contagious as corona. Also, cholera, once a patient is admitted into hospital, they can leave within a couple of hours, worst cases within 1 to 2 days, depending on how dehydrated they are when they arrived into the hospital. However, what we know about corona is that patients can need to stay in hospital for up to 3 weeks. And in a place like Yemen, that's impossible. We know that patients need ICU beds, they need ventilators. Speaking to NGOs, we've been told that there are only 200 ICU beds with ventilators in Yemen at the moment. I know the UN is expecting a further 400. I don't know if they've arrived this week, but the last time we spoke to them last week, they're expecting a further 400 beds with ventilators. However, that's just a drop in the ocean in order to respond to a pandemic like this in Yemen. Another difference between the cholera epidemic and the corona pandemic is that when the cholera epidemic was spreading across the country, people weren't afraid to go to hospital. There was difficulty in accessing healthcare and getting to the hospital, but the fear and the stigma wasn't there. And doctors weren't afraid of treating their patients. But right now, there is a fear and there is a stigma around COVID-19. People are afraid of admitting to the fact that they have corona-like symptoms because of the stigma that surrounds it. And the health system is collapsing under the weight of COVID. You know, there isn't enough PPE, there isn't enough oxygen, there aren't enough ventilators. There are shortages of everything, and health workers haven't been paid in years, and they don't have protective gear or adequate training on how to respond to the corona pandemic. And that's leading to many local doctors deserting their posts. We're hearing reports of dozens of local health facilities shutting down because the doctors aren't going to work, afraid of dealing with the corona pandemic and of they themselves contracting the virus and spreading it to their families. You know, the perception of COVID and cholera on the ground is different. You know, cholera doesn't have the same taboo and fear. There was an openness to name it. There was an openness to tackle it. NGO workers were able to get visas to go into Yemen to work on cholera. But the local authorities, particularly Ansar Allah on the north, have created a sense of fear that foreigners are the ones bringing corona into the country. And this messaging can have a detrimental effect on how NGO workers can actually tackle the virus on the ground. It's making it incredibly difficult for them to do their jobs when the patients are afraid of the foreigners treating them. And also the authorities have really waited to do what is absolutely necessary. They haven't closed markets, they haven't warned the population properly or insisted that they stay in their homes. We're still seeing markets busy, we're still seeing shops, mosques busy, it's a really terrifying sight in comparison to what we're seeing here. So what are the most vulnerable areas that are going to be hit hardest by the coronavirus? As I mentioned before, IDP camps, internally displaced people camps or settlements, are amongst the most vulnerable populations. Generally in Yemen, we have a water problem. So respecting proper hygiene measures is difficult when you don't have water. So that general rule of maintaining hygiene, washing your hands, washing your supplies is almost impossible. Social distancing in these places, especially in IDP camps and in tight-knit neighborhoods, is almost impossible. We're seeing places, and for me, I find this terrifying, is hearing reports that places like Gat markets are still open and are still running at this time. For those of you who know Yemen, you'll know about Gat, and Gat is a green leaf drug that is commonly used in Yemen. Gat markets receive thousands of customers at the same time on a daily basis. And it's terrifying that they're still open. Mosques during Ramadan are still open and holding mass prayers. And everyone is really, really worried about the Eid celebrations that are due to take place this weekend, which the tradition is that families visit every single member of their family to wish them a happy Eid, which is a terrifying prospect knowing what we know about the coronavirus. There's also great concern about migrants in Yemen. In the last 2 years, we've seen a record number of migrants arriving from the Horn of Africa, trying to make their way to Saudi Arabia through Yemen. Some of them have been locked in detention sites in areas like Marib, and these detention sites are places where COVID could spread freely. We're also hearing that these migrants that are traveling into Saudi Arabia and actually making it there are reports that during the height of the corona pandemic spreading in Saudi Arabia, they were actually sent back from Saudi Arabia across the border into Yemen, which is rather than being contained in Saudi Arabia or sent back home. In the north, there was already a stigma towards migrants, but that's been exacerbated by Ansar Allah announcing that patient 0 in the north was a Somali migrant, even though we know that that actually isn't the case. And I'll elaborate on that further when I talk about the reporting that we've been doing or trying to do in the last few months. The front lines in Yemen continue to be active. There's no ceasefire in place. The frontline areas, with front lines active, it means that people that live in those areas are continuously displaced, having to move from their homes to other family homes or to friends' homes or to IDP camps. And this movement of families from one region to another is another terrifying way of how this virus could spread across the country. So I just want to move on to talking about the numbers that have been announced by the World Health Organization. So there have been a confirmed number of 184 reported cases in Yemen, 5 of which have fully recovered and 30 confirmed deaths. Now, most of these reports are coming from the south, so in Aden, Lahj, Abyan, and in Taiz Governorate as well. But I just want to clarify, because it's really important, and it was the same with the cholera epidemic, that these numbers do not reflect the reality on the ground. You know, just like with cholera, we will never actually know the real numbers in Yemen. And not only because there are many people that are disconnected from the main cities and are living in the, you know, in the mountains, villages in the mountains, but there just isn't enough testing kits. You know, one health worker from an NGO told me that there are approximately 3,000 testing kits for the entire country, which means that they're using them very selectively. And these numbers only reflect people that have been tested and confirmed to have COVID-19. They don't reflect the people that have corona-like symptoms at home, people who have gone to the hospital that have not been tested. But what we do know, to be able to think about how things have changed from before the coronavirus began to spread, is that Care International reported yesterday that there has been a 10-fold increase in death rates since the beginning of the coronavirus pandemic spreading, so since March. And that's really terrifying, but I just want to, I want to add something really important, because it's really easy to take that number and blame it solely on the coronavirus pandemic. But it's really important to add that since March as well, it has been the rainy season in Yemen, which creates fertile ground for other diseases to spread as well, like diphtheria, dengue fever, malaria, and cholera. And so, of course, this increase in the number of deaths could also be related to those diseases too. So yeah, I wanted to talk about the predictions by the World Health Organizations. And these are predictions that we're also hearing from other NGOs in Yemen, that the best case scenario, if Yemen was to abide by all the different advice that it's been given, the authorities in Yemen abide by the advice that they've been given by the World Health Organization, is that 42,000 people will end up dying from the virus. That's the best case scenario. The worst case scenario, if things carry on the way they are right now, with the authorities not taking this seriously, not giving out clear messaging to the people in Yemen, we could see around 93% of the 30 million population infected with this virus in the next couple of months. You know, there really are terrifying figures. I wanted to discuss, I've been asked this many times in the last week, and it is, why aren't we reporting on what's going on in Yemen? Why isn't there a lot of reporting on what's happening on the ground? I had a news piece go out last week, which I can share the link to after this talk. But really, it wasn't sufficient enough to tell what is actually happening on the ground. And I wanted to tell you guys about the difficulties we are facing as journalists trying to get this message out. I'm relying on a local team in Yemen. The authorities there in the north of Yemen have completely banned reporting on the coronavirus on the ground. And that means anyone who reports on it ends up in jail. And it's quite simply, that has been the case for us. In March, we entered a hospital called the Kuwait Hospital, which is one of the best equipped hospitals to deal with COVID-19 in northern Yemen. My team was able to spend a couple of days there. At the time, there were already cases of COVID-19 in this hospital, even though the authorities in the north hadn't announced the first case of coronavirus. In the hospital, Kuwait Hospital, which is one of the best equipped, one of the doctors told us, and we saw that there are 16 beds prepared to deal with corona. This is the best equipped hospital, and they only have 16 beds with ventilators preparing to deal with patients that will come in with COVID-19. there was treatment already going on, but the authorities hadn't announced any cases. And our sources told us that the first case, patient 0, that entered northern Yemen had actually come from Umrah in Saudi Arabia in early March. So we suspect, and NGOs we have spoken to on the ground suspect, that the virus started spreading in northern Yemen from as early as early March, even though the announcement of the first case took place late April. I'm about to conclude, and then I'm very happy to open up for questions, but one of the main issues in Yemen, and it's the main issue, whether it's in the war or previous epidemics, is that what we've seen across the world is to successfully fight a battle like this. And I'm calling, the corona crisis a battle because it truly is another front to this war. You need a central unified government, some sort of power to steer the way. But Yemen is essentially run by militias, whether it's in the north or in the south, it's being run by militias. The government doesn't have much of a presence in the country. Initially, we were hoping that the threat of the coronavirus reaching Yemen could have been a reason for the warring parties to respond to calls for peace. There was a hope that this imminent threat that will have an impact on the lives of all Yemenis, no matter where they're from or what region they live in or whose side they support, could lead to the warring factions coming together, and it could possibly lead to a pathway to peace or to a resolution to this war. However, although there's been a positive vocal response to the UN's plea and the UN envoy's plea for this, what we're seeing is that the fighting is continuing on the ground. And I'm going to end with something that the UN envoy said to the UN Security Council that I think really hits the nail on the head. He said, Yemen cannot face two fronts at the same time, a war and a pandemic. And the new battle that Yemen faces in confronting the virus will be all-consuming. And I fear, it just might be a little too late for the warring factions to come together to try and respond to this crisis. Thank you so much, and it would be great to open up for questions.
Thank you, Nawal. That was so clear. I think you covered an enormous amount of ground.
I tried to keep to time.
Well, no, thank you for that. And I'm going to actually take sort of chair's prerogative here and fire off the first question. I mean, the ceasefire hasn't taken root, that's absolutely clear. But to what extent the lack of cooperation between the various parties here is also antagonizing it? Is there any sign that they could start cooperating? I mean, Ansar Allah or the government of Yemen and other parties in any way to try to establish some ground rules, as it were, to handle the pandemic, some sort of measures of how they can try to mitigate against the worst, possible outcomes? Is there any sign that they are thinking of doing this?
I mean, unfortunately, from what I've seen in the reporting that I've done and from speaking to the different sides, it doesn't seem to be the case. One of the main issues that we're seeing, particularly in the north, is that they seem to be oblivious to the fact that this virus is actually spreading. A lot of the conversation I've had with some of the leadership in the north about the coronavirus, the response has been, don't worry, it's not spreading here, we're taking care of it. And that is the problem. It seems like we're going to have to wait until things are really bad, and then it's impossible to actually contain this and to avoid the worst before there is a realization that the warring factions have to come together in order for us to be able to tackle this and to save millions of lives.
Right. Thank you for that. I'm going to call a couple of people to ask some questions now. We'll try to start off with, there's a number of questions on humanitarian aid. Paul Hughes Smith, Paul, are you with us? You had a question, your first question about US aid to Yemen.
Yes. Hi, Nawal.
Hi, Paul.
Thank you. Thank you for that rather bleak message. Yes, I wanted to ask you really that the US has withdrawn most of its aid to Yemen and its financial support to the World Health Organization. I mean, that's, since I asked this question, they have given a bit more of it back, but not very much. Do you think that a severe outbreak of COVID would be likely to change US policy or possibly bring about a longer term ceasefire? And my second question was about journalists in Yemen. And as you mentioned, they're all in prison in the north, but those journalists that are still reporting have to practice self-censorship. And what hope is there that the international community, and let alone Yemenis, will ever get a true picture of COVID and its progression? And what kind of restrictions are international journalists under in that same respect?
Thank you. Nawal.
Thank you, Paul. I think, you know, you're right. The US pulling out its aid, I had that as a part of my notes for this talk, to be honest. And then, like you said, just before we went online, I read a piece that some of that funding is coming back. I think 120, I'm not sure, but I don't want to state numbers that I'm not certain about. But you're right, there is some money coming back. But from speaking to NGO workers on the ground, this pulling out of funding is having a major impact to the COVID-19 response. It's meant that, first of all, the World Food Programme's operations have been cut in half in the north. Food that was meant to last for 1 month is having to last families for 2 months. It's meant that money that this money was being used to pay local health worker salaries. You know, we know that the public health system hasn't been paying salaries since, I think, the last 3 years now. And that money was being used to pay these health worker salaries. And that, unfortunately, has all been cut. We know that a big chunk of UN employees in Yemen have now left the country as a result as well. Whether a mass outbreak of this crisis means that the US will reconsider its decisions is, you know, my guess is as good as yours, because President Trump is so incredibly unpredictable. I couldn't even, you know, I can't guess at all. I really hope it will. I hope there will be a response and some sympathy to what's happening on the ground. But also it's important to add that the Houthis have to reconsider the way they are treating NGOs and the way they are, you know, creating obstacles for NGOs to do the life-saving work that they're doing in northern Yemen. And I think one of the reasons that the Houthis have decided to cover this up and don't want to be open about what's happening in the north with the coronavirus pandemic is it's come at a time where there's major resentment towards Ansar Allah for the way they've treated NGOs, which are seen as, you know, life-saving heroes in northern Yemen. And so at a time where the US had publicly announced pulling funding, the last thing they needed was to announce that a new virus was looming and the NGOs were having to turn their backs on the people as a result of the actions of Ansar Allah. When your second question about the media and having to self-censor, to be honest, I'll be completely frank with you. When I was working on that piece last week, there was a lot of self-censorship, mainly because I was worried for the safety of my team on the ground. And so, you know, we said the facts. I wanted to go into more detail about how much we knew about the virus spreading in the north since March. And we did touch on it at great risk, but we couldn't go into too much detail. We couldn't use any of the interviews with doctors on the ground from March telling us about this, because we had to make sure we take seriously contributor safety. You know, when they told us it in March, they didn't take into consideration what that would mean when it goes on TV in May. And so we weren't able to use any of those interviews for their safety. I'm trying really hard to get to Yemen, and hopefully I will be going very soon, fingers crossed. And so I'm really hoping we'll be able to do some reporting from there. Of course, I'm really lucky because I get to do the reporting and then come back home to the UK when it goes out. And so it means I don't get in a lot of trouble. And so we're really hoping we're going to be able to do that to show a clear picture of what's going on in the ground.
Thank you, Nawal. Ian Scobie had a question on aid. Ian?
Hi, it was just really a very general question. With things like, you were talking about cessation of flights and the rest of it, what is the situation with humanitarian aid? Is it getting in? And if so, how is it getting in? And thanks also for this really informative talk.
That's great. We'll take another question. We had a question from Bernie Howley about adult-child difference. Bernie, are you with us? Hi, Bernie.
Hi there. All across the world, you know, we're seeing this big difference about how it's affecting adults, how it's affecting children, how they're picking it up, the symptoms and how it's transmitted. Do you think, given the nature of the population in the Yemen and how malnourished children there are, etc., whether this pattern will be the same, or do you suspect that it may, you know, be quite different?
Okay, I'll start with the aid. You know, we touched on this earlier, but you know, aid is getting into Yemen. It's trickling in. It's getting in a lot better than it was in 2017, actually, when I was there. But unfortunately, the funding has decreased since then. So there just isn't enough to cover the needs in Yemen. However, you know, of course, there's also NGOs, as I said earlier, are facing a lot of problems in the north because Ansar Allah have made it very difficult for them to distribute aid in the way that they would wish to do so. They've tried to apply tax on aid that's coming in, a 2% tax, which was, you know, a great point of debate for that led to the US withdrawing its aid in that area. Bernie, that's a really good question, and it makes me think about the conversations that we were having early on with NGOs when we were doing research on Corona and what to expect in Yemen. There was some good, you know, there was some hope in it because they did tell us at the time we weren't seeing a lot of young people contract the virus here in the UK. And, you know, we're learning about this virus on a daily basis, even here in the West. At the time, we thought that younger people aren't impacted by the coronavirus in the same as older people. And so since Yemen is a very young population, we were hoping that maybe it wouldn't impact the country so much because it has a very young population. But also, on the other hand, one of the terrifying statements that have been made by one of the NGOs is that because there's such a high level of malnutrition amongst children in Yemen, and therefore they have very weak immune systems, they've said that Yemen could be one of the only countries in the world where we see mass child deaths as a result of the coronavirus because of children in Yemen having such a weak immune systems. Now, these are all assumptions because, as you all know, we're learning about this virus on a day-to-day basis, and we can only wait and see what ends up happening.
Thank you for that. We've still got a couple more questions on the sort of more humanitarian front. I can turn to James Farbrace, who I think is now the chairman of the British Yemeni Society. James, you with us?
Can you hear me?
We can.
Yes, I can.
Yes, okay. Hi, Noel. Fantastic
Hi,
presentation
James.
on such a tragic situation. No, you mentioned that coronavirus, as opposed to some of the other many diseases that Yemen is facing, has been stigmatized, that people face a lot of stigma and therefore don't want to necessarily get the aid and so on, or admit it to relatives, and presumably. Can you comment why that might be the case?
I guess it's the case with any disease that's so incredibly contagious, is that people don't want to admit that they have corona-like symptoms because they're afraid of how the people around them are going to view them. The other thing is the way the authorities on the ground, especially in the north, have been dealing with people that admit to having corona-like symptoms, having trucks come into neighborhoods, locking down the neighborhoods, shooting in the air, yelling at people to go home because someone in the neighborhood has corona-like symptoms, taking the person away and then putting them in really dire quarantine facilities that have been set up across the country. And so not only is there a fear of admitting to it and then being taken to one of these quarantine facilities, but also it creates stigma because the way people look at this one central family in the neighborhood that could essentially be spreading it across the entire neighborhood. So I think that's where the stigma is rooted from. And it's usually the case with any disease that's so highly contagious. But actually, I wanted to add something. One thing that's been really terrifying from speaking to people on the ground in Yemen is that there is an uptick of people dying from lung infections or from sudden heart attacks or suddenly not being able to breathe, symptoms that really sound like corona. But what's terrifying is that people are still going to funerals to pay their condolences at the homes of these people, which, if these people did have corona, would mean it's just helping the spread of this virus further.
Thank you, Nawal. I've got another question from Hamdan Damag. Hamdan, are you there?
I know Hamdan, yeah.
Yes, hello, hi. Can you hear
Hi.
me?
Yes.
Hi, Nawal. I just wanted actually, if you have more information or even from your own personal understanding of the situation, if you can elaborate more about the worst case scenario that can happen in Yemen, both in the direct fatalities that we can expect or on the consequences of other aspects like economy. And the reason I'm asking this is because although we don't really like to think of it this way, I feel we are not going to be really far from this scenario.
No, I completely agree with you, Hamdan. It's a really grim situation, and I think the way things are panning out and the way the authorities are dealing with it, it seems like we're closer to the worst case scenario than we are of the best case scenario. What the World Health Organization is saying is that they expect over 40,000 deaths, and this is one of the best case scenarios, and that 93% of the 30 million population will end up contracting the virus. And of course, we can't say how many will have the most severe symptoms of the coronavirus because you're just unable to tell. We don't know what is, the reason why people have such bad symptoms while others seem to be asymptomatic or aren't impacted so negatively. But what we do know is that Yemen has such a high level of malnutrition and therefore weak immunity. And so practically 2/3 of the population have underlying health issues. We hear this time and time again here in the UK. If you have underlying health issues, then you are high risk. Well, Yemen is a nation of 2/3, where 2/3 of the population have an underlying health issue. They are malnourished. And so that means, I think what we'll end up seeing will be catastrophic. I think it's really important to not just think about this as statistics. People in Yemen, families, fathers and mothers, have really difficult choices to make every single day. When we were covering the cholera epidemic, what we saw is fathers had to decide whether the whole family gets to eat today or whether his son or his daughter were going to go to hospital because they were sick with cholera. And I think now there's an added layer of difficulty, difficult decisions that are going to have to be made amongst families. And it's really, really sad to fathom.
Thank you. I'm going to be coming on to some questions about the UK role that people have been asking, and also some questions regarding the South. But just to continue a little bit about humanitarian access, we have a question from Richard Burton. Richard, are you with us?
Yes, I'm here. Thanks, Nawal, for that introduction. Very sobering, but very, very helpful. You mentioned on humanitarian aid that access was a little easier than it used to be. And I wonder if you could just tell us a little bit more about access issues, and in particular, what the current situation is in Hudaydah and as a gateway through to aid. If I could perhaps just add one other thing to a question I was in the middle of typing, Chris, so as I've got the floor, I'll just add that on if I may. Could you say something about what the UK's current performance is in its role as UN penholder on Yemen? What is the UK government doing at the moment? and what should we be pressing the UK government to do? Thanks.
Thank you, Richard. We certainly miss you in Parliament because you were one of the MPs who did follow Yemen with a keen interest. Noel.
In terms of Hodeidah, to be honest, I haven't been following it too closely, but what I do know is, you know, the situation there is a lot better than it was in 2018, 2019, when the Hodeidah offensive was imminent and the port was at a halt. You know, speaking to NGOs on the ground, aid is getting through. I think that means that shipments are able to come into the port. Aid flights were landing before March this year quite swiftly, but once Ansar Allah imposed the lockdown on flights coming in, and the authorities imposed that lockdown, it also was a lockdown on aid flights getting in as well. But based on what the UN is saying, we spoke to them last week, just as of last week, 8 flights are resuming. So it seems to be that getting aid into the country has become the easier part of the process. The most difficult part now is distributing it within the country, which has proven to be a lot more difficult in the north than it has been in the south. In terms of the UK's role, I think the UK could play a much bigger role in the peace process, on putting pressure on the warring factions to reach some sort of political resolution. I know the UN envoy is doing the best he can, but he could definitely have more support from the UK government in the role he plays. And of course, the UK could play a leading role in supplying more aid into the country as well. But yeah, I haven't been following closely how the UK's involvement has changed in the last couple of months.
Thank you. We have actually a number of other people wanting to ask about the UK role. Dean Kingston, Deanne Kingston, are you there with us?
Oh yeah, hi. Yeah, my name is Jan. All right, sorry. Yeah, my questions are like, what is the UK government doing in regards to handling all the medical entities like hospitals to a third party that is neutral and capable of dealing with this pandemic or this crisis? This was one part of the question. The other question is what can the UK government do to enforce ceasefire to enable medical reach the areas that are badly affected? Because I don't think the Arab alliances are helping, but they are contributing more to the conflict to worsen the situation. And just to point out, the Arab alliance have they are providing the Yemen conflict parties with weapons and have opened Yemen borders to the COVID-19, which is very bad, while they are keeping their own borders shut. So I wonder what is the UK doing in regards of these?
Before you reply, we also have Mohammed Al-Aswad, who wanted to ask about the UK role. Mohammed had a ton of questions, but I'll be grateful if you could just keep it to one and succinctly, because we are running out of time. Mohammed, are you with us? Perhaps not. Noel, if you want to ask.
I mean, in terms of the UK role, to be honest, I can't go into finer details, but what I would say is the UK is supporting one of the main warring factions in this war, supporting Saudi Arabia with arms, in this conflict. So one thing that it can do is definitely put more pressure on the side that it's supporting in order to kind of twist their arm into reaching some sort of political resolution. Another thing is speaking to NGO workers, and I know I've said this time and time again, they need more aid, they need more support, and the UK can play a vital role in that, in supporting the aid programs on the ground, putting pressure on its ally, the United States, to resume the aid that it was already giving to Yemen. This is a vital time in Yemen's humanitarian crisis, and the international community really needs to come together to support Yemen's people.
Thank you very much. Now we have a couple of questions really about the South, and I'm going to call Karen Dabrowski to ask her questions.
I have to say that a lot of my, the focus of our reporting the last few weeks has been in the North, but I'll try my best to answer.
Karen. Is she with us? Perhaps not. Okay, then we had one from Viresh Josh. Viresh, are you in the...
I think I'm here.
Yes, hi.
So thank you for your talk. I was wondering if you could sort of explain whether the declaration of sort of Southern independence has had any impact on the response to COVID in the South, and whether you think that this will have any sort of long-term impacts, particularly given the UAE support for the Southern Transitional Council. Do they have any sort of additional capacities or even a greater appetite to tackle the virus in the South? Thank you.
I mean, what I would say is two things, is that the problem in the South is that because there isn't one clear leadership, there has been very mixed messaging, which hasn't been helpful in dealing with the coronavirus on the ground. The STC with one message and the government with another message, and people not knowing who to clearly follow. In terms of the response, you're right. The UAE could play a vital role in helping the response to this virus, helping with supplying the South with more aid, with more supplies that would help it tackle the situation. We're hearing today, I've received emails from NGOs in the South talking about Aden's health system collapsing completely because of the surge in corona cases in the last couple of days. So they could play a vital role in supporting the health facilities that are there. But as far as what we've heard so far, there hasn't been that support.
Thank you very much. Now we've got a question also from Paul Tipple. Paul, are you there?
I am indeed, yes, thank you. I'm the UNA campaign coordinator for Yemen, and we've worked closely with the Yemen APPG during the past several years, although that was with Keith Vaz and Max, so I'm looking forward to linking up with Tim and the new coordinator. Clearly, a ceasefire and a peace process is absolutely vital. But it does seem to me that the UK government is passing the buck to the UN envoy, rather than actually pulling out all the diplomatic stops itself and trying to broker a ceasefire. I mean, we have strong commercial and diplomatic links in that region, and we should be using them. So my opinion is that all of those in the UK that are concerned about this should be getting together to lobby our MPs to put pressure on the UK government to that end. So as I say, mine's not a question, it's more of a statement.
Well, thank you very much. And that was a reference to Tim Lawton you made there, who's the new chair of the all-party parliamentary group on Yemen, who was on the call, and I think he's just come off now. But
yeah, but it wasn't specifically directed to Tim. I mean, basically, anybody that actually feels they should be lobbying their MPs, I'm very happy to have my details shared. And I would be glad to get together with them.
Fantastic. I suspect, Noel, you may not have a lot of comment on that in terms of, but it's probably more for me and encourage it. I couldn't agree more to encourage people to get in touch with their MPs. Noel?
There's definitely, I mean, I completely agree. There's definitely more the UK government could be doing to support the UN envoys, please, 100%.
Excellent. Yeah. So, right, we are now, Karen, are you back with us at all? Karen Dabrowski? No. Okay. just right. I think the final two questions are perhaps actually some of the most important ones. I mean, Rafika Rajab has asked a question. Rafika?
Yeah, hi. I just wanted to simply, yeah, it's very upsetting hearing all this. I'm in Dublin, and Noel was over in September for a fundraiser we had. And it's wonderful to see you, Noel, and thank you very much for all this information. It's overwhelming. So it's a simple question, is like, what can we do? How can we help, basically?
And indeed, we had another questioner saying, did you have a charity, an aid agency that you thought was most effective in providing aid inside Yemen?
I mean, to be honest, I have been, I'm usually not allowed to do this, but I'll tell you guys anyway. I'm like stunned by the incredible work that Médecins Sans Frontières does in Yemen. I've been speaking to people on the ground. They're taking a leading role in dealing with the coronavirus as well right now on the ground. They completely are distance themselves from the politics on the ground, but just get on with it in the most difficult of places. And so if there was one charity that I would say deserves us, all of them deserve our support, of course, but I think MSF have been doing incredible work on the ground, have great plans on trying to deal with the coronavirus as best they can right now in Yemen, are already were reacting and setting up contingency plans in March when we were speaking to them. And so I'm a great supporter of the work that they do.
Excellent. Is Colm Ryder with us? You had a question that you wrote in about the Shia-Sunni divide in Yemen.
Yeah, thanks very much, Chris. I know it's a fairly general question. Noel, great to hear your voice again, to hear your.
Thank you for joining us.
And essentially, I'm talking about the Shia-Sunni divide and the Houthi, the government divide. Now, in general, it's sometimes not quite clear how they fall out, or do they fall out in that direction? In other words, on a religious sort of basis. But also the second thing is in relation to COVID itself, and I don't think you've quite said it in your talk there, is in relation to the different areas controlled by the Houthis and controlled by the government. Do you know how the situation is being dealt with? Is it better in the Houthi area? Is it better in the government area? Or are you aware of this? So just that is my general question. First of all, the religious divide, how it relates to the Houthi and formal Yemen government side of things, and secondly about their both sides' reaction or work on the COVID problem.
No, that's a really interesting question. I think, the Shia-Sunni divide in Yemen needs an hour talk in itself, and that probably wouldn't be enough anyway. But I'm going to answer the question on how the different sides are dealing with the coronavirus. I think it's very similar to each other. Of course, there's a lot more ambiguity in the north. There's been a banning of reporting in the north, so it's a lot harder to find out clear information about what's going on. In terms of how the health facilities will respond to this, the health system in the north is just as bad as the health system in the south. They're both struggling, and so both need as much support as each other. But no, I mean, the reason why I didn't distinguish between both is because the response and the situation has been very similar in both sides, in both regions. I would say maybe the government health side, there has been, they've been a bit more forthcoming about the number of cases on the ground. I said those numbers in my talk, 184 cases. But even then, from people we've spoken to in the south, they're saying that the number is a lot higher. And so even though they've reported some cases, they don't seem to be honest about just how many cases there actually are on the ground. We predict that a lot more people have died and many more people have contracted the virus in the south than they're admitting to.
Okay, thanks very much, Noel.
Thank you very much. Okay, I'm going to take one more final question from Naji Harazi. Naji. Are you with us, Naji?
Yes. Good afternoon to all of you. I'm glad to see Nawal and glad to see Paul as well. Many familiar faces. Chris, of course. Thank you all for this. I just want to thank Nawal for her good work. She's trying her best as a BBC, journalist, and we all are very happy with her. But would she agree with me? I mean, look, talking about coronavirus and talking about many crises inside the Yemen, would you agree is the best thing for the UK and for the rest of the world? The best way to help Yemenis dealing with all these problems is to just to call for an end to the war. We need to see an end to the war. We need to see lifting of the blockage, because the country is under blockage. We know that nobody can go or inside or leave the country without the coalition permission. They have to understand that the country is under siege. It's like a Gaza Strip. Yemen is under siege, unfortunately supported by international forces. We need to see open borders to go to Yemen. We need to see open borders allowing journalists and allowing politicians to go inside and talk to people who are fighting each other and tell them that stop fighting, stop creating more chaos, more problems, more death. Would you agree with that, Nawal?
Oh, 100%. I thought that's what I ended the talk with. Yemen cannot fight two wars at the same time. And in order for us to even begin to consider how to deal with the coronavirus, the war must end. And I think that's been our message from the very beginning, that in order for us to deal with the humanitarian situation, even before COVID-19 reached Yemen, with the starvation, the cholera, the unemployment, none of this can progress. We can't deal with this until the war ends. And the UK plays a vital role and can play a vital role, and is also responsible responsible for the fighting that is going on in Yemen because of its support for the coalition. And so it can play a leading role in ending the fighting and forcing the warring factions to reach some sort of political resolution. And I think, we've been discussing this, you and I, Amunaji, for years now. But I think as time has progressed, peace and basically recovering from what the war has done to Yemen gets harder as every day passes that it's still at war. Had it ended in 2015, 2016, it would have been much easier to have recovered from what the war has done in Yemen. But now here we are at 2020. We have a new crisis before us that Yemen is going to have to battle through. And it's really, really depressing and saddening that the war is still going on, and that the warring factions aren't putting the need of the people before their own.
Thank you very much. Thank you to Najib, but thank you to everybody on the call, for everybody to participate. I hope I got most people's questions in. I think a few people had left the call when I tried to call them, but I think we covered a huge amount of ground, and a huge thank you to Nawal there. A few announcements, if I may. We have another exciting event next week. Actually, I think probably very relevant in many ways. It's about the challenges and successes for Arab women reporting from the Arab world. It's going to be on Thursday, the 28th of May at 3 o'clock with the editor of a book that has come out, Our Women on the Ground, Arab Women Reporting from the Arab World. The speakers will be the editor Zahra Hankir, and two of the book's contributors, journalists Jane Araf and Iman Halal. All our details are on the website, and I think Joe has just circulated on the chat there. And you will also see on the chat a meeting in June that the British Yemeni Society is organizing on Yemen as well. I'm sure that will be extremely worthwhile for all people interested in Yemen. So it just remains for me to thank Nawal hugely for talking for well over an hour now, so clearly and succinctly. It's truly appreciated. I hope people will try to press their MPs, and they will try to support those excellent organisations we've been speaking about. And let us hope that things are not as bad as some of us fear they will be in Yemen, and ways are found to mitigate against the worst outcomes. Thank you once again, and look
Thank you so much to you all. And if anyone has any more questions, you can find me on social media at BBC Nawal, and I'll be happy to answer them.
Thank you, Nawal. Bye.